My name is Joe Murray. I'm a gastroenterologist at the Mayo Clinic and am consultant in internal medicine and immunology at Mayo Clinic, Rochester. I'm talking to you today about a recent report at the Digestive Disease Week regarding a reduced risk of cardiovascular disease in patients with celiac disease. Typically, it's not good to have any disease. Patients with celiac disease in particular can have a lot of digestive issues. They can also have malabsorption and its consequences. One of these consequences can be loss of weight. And in general, we have focused on the negative effects of having a diagnosis of celiac disease, the impact that it has on digestive health, the impact that it has on overall quality of life of patients, and the benefits that can accrue by being put on a gluten-free diet. Not all is bad, however, for patients with celiac disease, and this recent report by Kanga and colleagues from Boston, which was presented at the Digestive Disease Week, showed that there were reduced risk factors for cardiovascular disease. Of course, cardiovascular diseases are the most common causes of death and a major cause of illness in the developed world. Patients with celiac disease were less likely to have hypertension, less likely to be overweight, less likely to have high blood fats or lipids, and their likelihood of having had an illness related to cardiovascular disease or developing one, as in the almost 4.5-year follow-up that these patients had, was substantially less than the patients with celiac disease, or substantially less in the people with celiac disease than the people without. In addition, patients with celiac disease were less likely to have type 2 diabetes, which is certainly becoming one of the major health hazards of living in the developed world. So, why could this be? Well, one, patients with celiac disease are less likely to smoke. Now, whether this is because of socioeconomic reasons, that people are less likely to smoke if they are perhaps highly educated than people who are less well educated, and we know educational level may be associated with celiac risk. In addition, patients with celiac disease focus on their diet. The primary treatment is a gluten-free diet, but it provides the opportunity to really review their diet in detail. Often they will have met or will continue to meet with an expert dietitian, who of course is not simply focused on them achieving a gluten-free lifestyle, but a healthy gluten-free lifestyle. Well, whatever the factors are that are certainly of interest scientifically, I think this is one good piece of news we can give to people with celiac disease, that your risk of heart disease and other vascular disorders seems to be significantly less than patients who don't have celiac disease.